In this podcast episode, Dr. Trisha Pasricha, a neurogastroenterologist and medical journalist, explores little discussed yet vital aspects of bowel health and habits. The conversation challenges common misconceptions about pooping frequency, stool color, and gastrointestinal function. Dr. Pasricha reveals insights into the gut-brain connection, hemorrhoids, irritable bowel syndrome (IBS), probiotics, colorectal cancer trends, and even the science of farting. She emphasizes the importance of understanding healthy bowel routines, tackles misinformation, and sheds light on emerging research and medical practices surrounding gastrointestinal health. Dr. Pasricha explains her specialty in neurogastroenterology, the study of the gut-brain axis, how signals between the gut and brain influence digestive health. Her training combines internal medicine, GI fellowship, and a specialized neurogastroenterology program. Although niche, this field addresses some of the most common gastrointestinal disorders, such as IBS and functional dyspepsia, characterized by chronic abdominal pain without obvious physical abnormalities. Her research also extends to neurodegenerative diseases like Parkinson's, where initial pathology may start in the gut decades before symptoms surface in the brain. Balancing clinical work with research, Dr. Pasricha transitioned into medical journalism, inspired by mentors like Sanjay Gupta, aiming to combine rigorous medical science with accessible storytelling to destigmatize conversations about gut health. Dr. Pasricha points out that many adults carry habitual misunderstandings formed during early childhood potty training, with no ongoing education or professional check-ins similar to dental hygiene. This lack of dialogue fosters embarrassment and misinformation. In her household growing up, bowel habits were openly discussed with no shame, a contrast to the social taboos many face. In clinical practice, she found that a third of patients avoid discussing bowel symptoms due to embarrassment, and 40% report bowel habits interfering with daily life. This silence hampers recognition and treatment of common digestive issues. Normalizing open discussions about stool characteristics and bowel movements could empower people to optimize their gut health. A prevalent bad habit Dr. Pasricha identifies is prolonged sitting on the toilet, often exacerbated by smartphone use. A landmark 1989 study linked reading newspapers on the toilet to hemorrhoids. In today's context, smartphone usage extends time spent sitting, increasing hemorrhoid risk by about 46%, likely due to prolonged pelvic floor muscle strain and venous pressure. Smartphones encourage accidental extended bathroom sessions, sometimes exceeding the recommended 5-minute limit, fostering pelvic floor dysfunction and hemorrhoids. Managing time with deliberate positioning, such as putting the seat lid down and keeping pants on, may reduce this risk. Dr. Pasricha's ongoing research involves sophisticated monitoring of pelvic floor dynamics under these conditions. Fiber remains the most underutilized treatment for bowel issues in the U.S., with 95% of Americans failing to meet recommended intake. While fiber supplements like psyllium husk can help and are backed by studies, dietary sources are superior due to the complex nutrients and phytochemicals accompanying fiber in whole foods. Dr. Pasricha emphasizes gradual fiber introduction to allow microbiome adaptation, avoiding bloating or discomfort common with rapid increases. She also addresses common concerns where some people paradoxically experience constipation upon adding fiber, reflecting individual differences or underlying conditions like IBS or microbiome variations. The difference between soluble and insoluble fiber is often overstated. The overall goal is achieving balance primarily through diverse plant-based intake. IBS is a complex diagnosis often misunderstood both by patients and clinicians. Traditionally considered a diagnosis of exclusion when tests show no visible pathology, it is frequently mischaracterized as a psychological or all-in-your-head disorder. Dr. Pasricha elucidates that IBS involves tangible neurological changes in the enteric nervous system, including heightened sensory nerve responses to normal gut stimuli and microbiome alterations. This explains the real pain and discomfort patients feel despite normal colonoscopy or biopsy findings limited to superficial mucosa layers. She stresses the importance of validating patients' symptoms and cautions against exploitative third-party testing marketed towards vulnerable sufferers. Treatment is multifaceted and may include diet modifications, like the short-term low FODMAP diet, neuromodulatory medications such as low-dose tricyclic antidepressants that reduce nerve sensitivity, and lifestyle interventions. Probiotics represent a popular but often misunderstood and overhyped solution in gut health. Contrary to marketing claims, major gastroenterological associations do not broadly recommend probiotics except for certain specific conditions like pouchitis or ongoing clinical trials. Dr. Pasricha notes that live cultures in capsules often die before reaching the colon, and the current science does not firmly establish causative microbiome corrections through supplements. However, individual patients may report benefits, possibly due to placebo effects or specific strain responses. She advocates for consuming natural probiotic foods like live culture yogurts and fermented products, while highlighting the importance of diet over pills. The microbiome is more akin to a garden requiring good soil, nutrients, and fiber, rather than just planting new seeds, probiotics. The episode touches on the alarming rise of colorectal cancer, CRC, in adults under 50. While the incidence among older adults has declined due to screening, younger populations face increasing rates for reasons that are not fully understood. Dr. Pasricha highlights that early life environmental factors like diet, sugar-sweetened beverage intake, sedentary lifestyle, and ultra-processed food consumption likely contribute cumulatively. She emphasizes fiber's protective role and challenges the oversimplification of cancer risk to lifestyle choices alone, stressing genetic and epigenetic elements that stack the blocks of risk progressively from childhood. Screening remains essential, especially for those with family histories or symptoms, although guidelines and uptake vary. The conversation includes the tension between meeting screening demand from worried younger individuals and prioritizing those with clearer indications. Stool color provides important clues about digestive health. Healthy stool is usually some shade of brown due to digestion of bilirubin, a bile pigment, while certain abnormal colors can indicate issues. Clay-colored or pale stool suggests bile duct obstruction, requiring urgent evaluation. Bright red, maroon, or black sticky stools suggest bleeding from various sources, ranging from hemorrhoids to gastrointestinal cancers. Not all unusual colors are cause for alarm, as dietary pigments, beets, berries, red wine, can temporarily change stool color to purple or maroon. Dr. Pasricha encourages people to observe their stools regularly to recognize what is normal for them and identify abnormal changes, promoting early consultation when necessary. The commonly accepted idea that once a day is the gold standard for bowel frequency is not universally accurate. Normal stool frequency varies widely, with healthy individuals going anywhere from 3 times a day to once every 3 days. The colon exhibits circadian rhythm-driven contractions, especially strong in the morning, often triggered by coffee or exercise, which explains why morning bowel movements are common. The key is individual comfort and whether bowel habits interfere with daily life. Changes in stool frequency or consistency without obvious cause, such as stress, travel, or diet changes, may require medical evaluation. Understanding personal normal and being attentive to persistent changes helps differentiate benign variation from pathology. Farting, a physiological necessity, is often shrouded in humor and embarrassment despite its scientific significance. Humans pass gas 10 to 20 times daily, most of which is odorless. The foul smell results from sulfur-containing compounds, making up about 1% of the gas. Dr. Pasricha shares pioneering research measuring fart volume and odor concentration, revealing women's farts tend to be more concentrated with sulfur, while men produce larger volumes, resulting in comparable overall offensiveness. Remedies to reduce odor include bismuth subsalicylate, Pepto-Bismol, which neutralizes sulfur compounds but may cause harmless black stools. The episode demystifies farting and encourages open discussion about natural bodily functions without shame. Hemorrhoids remain a common concern linked closely to bowel habits and toilet posture. Overuse of stimulant laxatives like senna can be ineffective or counterproductive when used long-term. Fiber intake is the cornerstone of hemorrhoid prevention and treatment, yet diet is often neglected. Prolonged toilet sitting, especially with distractions like smartphones, exacerbates venous engorgement, contributing to hemorrhoids. Dr. Pasricha emphasizes lifestyle modifications, dietary fiber, and judicious use of supplements as effective treatments, advocating for better patient education to reduce embarrassment and optimize bowel health. A key frustration in gastroenterology lies in diagnosing conditions like IBS and other functional gut disorders due to current reliance on symptom-based criteria and superficial testing. Dr. Pasricha envisions transformative advances through safe, minimally invasive, full-thickness gut biopsies that would reveal enteric nervous system pathology, paralleling biopsies in liver disease today, and revolutionize diagnosis and targeted therapies. While technologies like electrogastrograms exist, they capture only coarse electrical activity, insufficient for detailed diagnostics. Research innovations in interventional endoscopy may soon bridge these gaps, dismantling current diagnostic shadows and reducing reliance on trial-and-error treatments and supplements. Throughout the discussion, Dr. Pasricha advocates integrating more fiber-rich whole foods, including legumes and various types of high-fiber pastas like chickpea, edamame, and mung bean varieties. She acknowledges cultural and personal preferences, emphasizing incremental steps such as adding more vegetables or beans rather than drastic restrictions to enhance gut health and reduce disease risk. For meat consumption, she suggests moderation, cautioning against processed meats due to strong links to colorectal cancer risk, and encourages leaner cuts like bison to reduce saturated fat intake. Awareness of cooking methods, such as marinating meat, may potentially reduce carcinogen formation, though evidence is still emerging. The episode unpacks the complex balance clinicians face regarding screening younger populations amid rising colorectal cancer rates. Clear symptoms such as rectal bleeding, unexplained weight loss, iron deficiency anemia, and changes in bowel habits warrant prompt investigation. However, some younger individuals seek screening without indication, driven by awareness and anxiety promoted by media coverage. Providers must carefully assess risk factors, personal and family history, and symptoms to guide appropriate testing. Stool-based DNA tests like Cologuard have limitations, including false positives in the presence of hemorrhoids and less sensitivity for polyps. Dr. Pasricha calls for continued refinement and individualized screening based on emerging evidence. The overarching theme stresses that embarrassment and stigma around bowel function hinder people from seeking help and understanding their own bodies. Dr. Pasricha champions frank, non-judgmental conversations about stool, poop, and related subjects. She deliberately uses simple, approachable language in her writing and clinics to break down barriers, encouraging patients to observe their bowel habits, colors, and frequency regularly provides important self-awareness that aids in early detection of pathology. Emphasizing that talking openly is healthy, she argues for societal normalization of what is a vital aspect of overall well-being. While probiotics are widely consumed, actual evidence supporting their efficacy remains limited and inconsistent. Dr. Pasricha compares microbiome health to tending a garden where soil quality, diet, and environment matters more than merely adding seeds, probiotics. Many probiotic supplements contain dead bacteria or strains that do not survive gastrointestinal transit. The microbiome's role is a frontier area with great promise, but also considerable complexity. Future advances may enable precision microbiome therapies tailored to individuals, but current products should be considered with caution and evaluated alongside other lifestyle factors. Dr. Pasricha reiterates fiber's therapeutic potential for IBS patients, but notes that responses vary widely. Some patients tolerate fiber well, while others experience symptoms like bloating or constipation initially. The low FODMAP diet can be useful short-term but requires careful reintroduction phases to avoid nutritional deficiencies and unnecessary restrictions. She discourages long-term adherence without professional guidance and warns against over-reliance on third-party testing marketed as identifying trigger foods. Effective IBS management often requires a combination of dietary modification, behavioral interventions, and neuromodulatory medications. Certain medications, originally developed as antidepressants, such as tricyclic antidepressants, are repurposed in neurogastroenterology to modulate gut nerve sensitivity and reduce pain signaling. These drugs can raise the threshold for nerve activation in the gut, relieving symptoms like abdominal pain and bloating common in IBS. They act primarily on the enteric nervous system, rather than central nervous system, challenging misconceptions that benefits arise solely from mental health improvement. Pharmacological approaches are part of a comprehensive, individualized treatment plan integrated with diet and lifestyle adjustments. Dr. Pasricha highlights concerns about patients seeking extensive, costly, and non-validated testing from third-party labs promising answers for unexplained gut symptoms. Many of these tests lack scientific rigor and can mislead patients into unnecessary dietary restrictions or expensive treatments. She advocates for evidence-based medicine, emphasizing validated clinical criteria and cautioning patients and providers to critically evaluate claims. Education and accessible, compassionate healthcare interactions remain essential to counteract misinformation and exploitative practices. The conversation underscores an exciting era of gastroenterology where research is delving deeper into the interplay of the nervous system, microbiome, diet, and genetics in gut disorders. Advanced diagnostic tools, better understanding of gut neurobiology, and targeted therapeutics hold promise to transform patient care and reduce stigma. Dr. Pasricha expresses optimism that, like progress seen in other medical fields, gastroenterology will develop more precise, personalized approaches in the coming decade, improving outcomes and quality of life for patients with both common and rare digestive diseases.